You are an FI1 working on a general medical ward. A medical student has just started her general medical placement and is attached to your ward. She has told you that she needs some experience of intravenous cannulation. You have a patient who needs a cannula, and the medical student is keen to do it. She tells you that she has only performed cannulation on a dummy arm. Rank and order the following actions in response to this situation. 1 equals most appropriate, 5 equals least appropriate. A. Ask the student to demonstrate her cannulation technique on a dummy arm. B. Ask the student to observe you while you cannulate the patient. C. Ask the student to perform the cannulation. D. Go and put the cannula in yourself. E. Observe the student while she cannulates the patient. Answer E, B, A, D, C. Part of a doctor's role involves teaching as well as providing adequate supervision to those who are learning. The best way for the student to practice her skills is to learn through performing the cannulation. However, given the student's inexperience, this should be under your supervision, as in option E. Options A and B are also appropriate since they too give the student an opportunity to learn. Observing you, B, however, is a more favourable option than practising on a dummy, A. The student has already had experience with a dummy arm, and it is important to learn how to interact with and gain consent from patients for procedures such as cannulation. Putting the cannula in yourself without giving any teaching does not fulfill your role as a teacher, and sending an inexperienced student to cannulate alone may result in harm to the patient. Options D and C are therefore inappropriate. As an FI2 in a GP surgery, you see a 24-year-old female who tells you that she is experiencing postcoital bleeding and dyspareunia, pain during sexual intercourse. As part of your assessment of this patient, you need to perform a speculum examination. However, you haven't done this examination since medical school and do not feel confident doing this without assistance. Rank and order the following actions in response to this situation. 1 equals most appropriate, 5 equals least appropriate. A. Advise the patient to return to the surgery in 2 months if she is still experiencing difficulties. B. Ask another GP to observe and assist you while you perform the examination. C. Book an appointment for the patient with another GP in the practice. D. Observe another GP examining your patient. E. Perform a speculum examination anyway. Answer B, D, C, E, A. If you do not feel completely confident in performing an examination or technique, it is useful to adopt the mentoring approach. This involves learning the scientific basis for a technique, then observing a competent mentor performing the technique and finally carrying out the technique yourself with a mentor who can give guidance and advice while you are building up your own competence. In this scenario, you have already successfully carried out the technique but feel out of practice. Therefore, the most appropriate option would be to talk through the procedure with another GP, a mentor, and then ask the GP to observe you while you perform the examination. B. Observing another GP performing the technique, D, may be useful if you feel that you could not perform the examination, but as you are simply lacking in confidence with the technique, it is likely that you only need some assistance and support. Booking an appointment with another GP, C, could result in a delay to the patient's treatment and would also be a missed learning opportunity for yourself. Performing a speculum examination without mentor supervision, E, may mean that the patient experiences pain or that you are unable to complete the examination if you do it incorrectly. This could also damage your confidence with this examination and impact your future practice. However, this is preferable to option A, which would cause diagnostic delays, and if the patient returned to see you again, you would still have the same issues.